We have about 1,000 to 1,200 presentations of young people that are coming to us saying that they are homeless each year. The majority of those young people are young women. The most common determinant for them becoming homeless, they would report, is family conflict.
The issue of homelessness is growing. So what we see through our experience in delivering services is that there are a myriad of factors that are contributing to homelessness in Victoria. One being affordable housing. So there is a clear lack of affordable housing for people on low incomes. And we're also seeing that there are complex social issues that also marry up to homelessness. So those issues being mental health issues, family violence, drug and alcohol issues.
We still have 64% of people presenting for homelessness support as a direct result of domestic violence. I mean, to me and to this organisation, that sort of statistic is just unacceptable.
Often with community sector services, the staff turnover is pretty high, so when a young person gets a relationship with the community services worker that's working with them, that person will suddenly move on, then they have to start all over again. So they lose, the families and the young people lose confidence in the system and the service.
You have to wait for a young person to become homeless before you can provide a homelessness service to them.
The Barwon area has probably had an increase of 15 to 20 properties that have been directly provided to women and children who are leaving domestic violence. So if you layer that up next to the demand, it's nowhere near meeting the demand. So the direct result is that you have women and children living in motels.
So there is a strong intersection between mental health and homelessness, and some of the reasons for that, people being unable to sustain jobs, for example, due to their mental health, therefore being unable to actually access either the private market, but also because of mental health issues, experiencing barriers to actually access housing in the first place. People who experience mental health issues also need support in the home. It's not enough to just house them, and that support needs to be tailored towards their mental health needs, but also their engagement with the community, which is essential for wellbeing.
So COVID has had a huge impact in terms of we have seen rates of family violence increase at a family level. We've had less workers able to be inside those homes to be able to identify child and adolescent risk or family violence risk. We have had services continuing all the way through. We've had to limit the amount of face-to-face due to worker safety reasons. We know that at a household level there's a lot of conflict occurring. We know that we're not as close to that conflict and that risk as we had been previously, and so we're unable to mitigate that. That means that we're seeing more young people move into crisis programs like homelessness.
There's been a real increase in rough sleeping, and there's also been a real presence of single people.
We'd managed to, and this is in hard evidence, reduce adolescent homelessness in Geelong by 40%. So there'd been a 10-year kind of pattern of homelessness, about 230 young people, adolescents becoming homeless every year. That's been reduced to about 100, and we hope that that will continue despite COVID-19. At the same time, we saw some evidence of an improvement in the 3 original pilot schools of about maybe 20% in kids remaining, young people remaining engaged in education, and the disengagement had gone up in other schools. So we're working on checking that that's been sustained, but they're absolutely significant results.
We've had a massive reduction in kids being homeless, and also a much better engagement of students to finish through to the end of Year 12. And it's been quite significant. We used to lose a lot of kids through becoming homeless, couch surfing, then disengaging from school, whereas now we ensure that they stay engaged at school through that period of time while we assist them and their families to sort out whatever issues are presenting for them outside the school.
So the evidence is there, the policy is there to match it. Unfortunately, it appears that the resourcing is just not there to match it. So if the resourcing indicated or was married to the policy and to the evidence, then we would be seeing hundreds of thousands of properties built specifically to house women and children who have left family violence.
By the time young people become homeless, they're already dropped out of school, dropped out of the neighbourhood, engaged in drug and alcohols, their mental health has declined. The housing policy for young people, we would advocate, really needs to move to an early intervention program where we're working with schools and families to prevent homelessness occurring, to keep kids in school.
That it's not just for one department. So while the Education Department operates schools, and that's fine, Department of Health and Human Services operates community services, youth services. Those two departments need to work together at all levels, right down to the ground where they do work together here, because the model demands it.
We need to look to policies that actually integrate more service streams. So we need to have mental health services, homelessness services and all health-based services working together in collaboration.
A shift from targeted programs perhaps to a place-based approach. And I think Victoria is certainly inching along that direction.
The issues are challenging, but if you work together and across departments, then I'm sure that we can address these challenges.